There we go. My sexy voice.
It is. It is. Stevie Nicks, eat your heart out. So it sounds like there were some good things and some bad things that came out of your conference.
Yeah,
And hearing that cough, I'm
the bad
focusing on
thing.
the, yeah, yeah. Do you want to tell me a little bit more about what happened?
Yeah. First of all, the conference is called the Association of Healthcare Journalists, AHCJ, and it takes place every year in a different city in the States. So this year it was in St. Louis, Missouri. In previous years, it's been in Cleveland, Phoenix, Baltimore, Boston. And it's a really great opportunity because for 4 days, journalists, either freelance journalists like myself, or people who work for like TV news channels, programs, they gather together to talk, to listen to presentations about topics that people would like us to discuss, to write about or to do reports on. And one of the really great things that I love about this conference is on the Thursday, they have field trips. And of course, there's a limited number of people who can go to the field trips, but the field trips are organized to showcase health and wellness issues that are very prominent in that community. So for example, this year in St. Louis, I got to see a clinic where a doctor, his name is Dr. Punch, runs a bullet removal clinic.
That
Because
sounds appropriate, a trauma surgeon with the name Dr. Punch.
I know, right?
So yeah, that
He
reminds
was,
me of the orthopedist Dr. Lim,
yeah,
so
yeah.
there you go.
He was fascinating because he was saying that a lot of times bullets aren't removed, and that causes a lot of other problems, including psychosocial issues, knowing you have a bullet in you, that sort of thing. And he showed us like it's a comprehensive clinic. He's got psychologists and a massage therapist and an acupuncturist and a social worker and him and a nurse. And not only do they remove the bullets, but they give them what they need to take care of their wounds, what they need to take care of their body. Because in his words, the gun violence isn't the problem, it's the trauma that caused the gun violence to begin with. And of course it perpetuates. So
Sure.
as a Canadian, that was really eye-opening for me. We read about all the gun violence, but the fact that he left his lucrative trauma surgeon practice to do this was so telling. And it was just really eye-opening. And then he also runs another clinic that helps people get clean or to manage their addiction. And that's on another.
Because addiction can lead to trauma and gun violence,
Exactly.
etc. Okay.
Exactly. So we learned about that. And one thing that I really absolutely loved, and I'm really sorry that we didn't spend enough time with her, so I'm going to follow up, is a young woman who I believe she's the only, but she's definitely the first certified professional midwife in Missouri. She is a Black woman who had horrendous experience giving birth when she was only 14. And it was repeated again when she was 18, I think. And she said, nobody should have to go through this. So in her little world, she's trying her best to keep other women from going through what she went through. She went to Ghana to study African and indigenous midwifery practices. And when she came back, she couldn't find anybody to be a preceptor. She ended up getting a scholarship from the University of Utah, and she studied midwifery. Now, there's a difference between the nurse midwives and the certified professional midwives. Nurse midwives generally work in the hospital. They can be with you when you deliver, while certified professional midwives usually work at home in the home environment.
Okay. Can certified nurse midwives also work from home, or is that strictly?
I believe
Okay.
they can, but that
Okay.
I'm not 100% sure about.
Yeah.
But she had a really hard time because unfortunately, there was racism, and she was having difficulty with the client she was looking after. So she finally insisted with her preceptor that she had to work in her own community, and her preceptor
Okay.
agreed. So she ended up developing this village where she was teaching women how to be doulas, teaching women who were pregnant and their families.
Can you explain what a doula is? Just because sometimes some
Oh,
people don't
sure.
know what the difference is between a doula and a midwife.
A doula is a non-medical person who has studied birthing, pregnancy, birthing, and postpartum for several months after, and they're your support system. They
Okay.
really help you. My
Like a
daughter-in-law,
patient advocate?
a patient advocate, there you go. My
Okay.
daughter-in-law used one too, because it's somebody who's not related to you, who knows this stuff. And often it's easier to have an objective third party person with that kind of thing. So because of her really horrendous, this woman's horrendous experiences, she said women need to be able to advocate for themselves. The families need to be able to advocate for their women who are giving birth or birthing people. And so she really went all out and founded this birthing village. And now she's actually doing a capital campaign because she bought a bigger property because she wants to enlarge it. She wants to have this little, there's going to be a greenhouse where women in the winter can sit amongst all the greenery, and they can have their food from there. There's going to be little huts all around the village, the main building, where women can recover for 5 days after their delivery, because we know that the maternal mortality rate in Black women is horrendous. It really is. It's
So a
terrible.
little bit different from a hospital where if you have normal childbirth, you can be out the door within 1 to 2 days. And if you've had a
Exactly.
cesarean section, you can be out within 2 to 3 days.
Exactly. And then what this does is, we know as health professionals that the majority of maternal mortality happens within the first week or two after pregnancy, after birth, right? Because you can have hemorrhage, you can have infection, which can lead to sepsis and all that other thing. So she has them in these, sorry?
And eclampsia.
Oh,
That was the
right.
one that would always get me nervous.
Yes. I
It's
hadn't
when
even
you
thought
have
of that
very
one.
swollen feet, high blood pressure, and they don't know they have high blood pressure because they're not checking their blood pressure. But they
Exactly.
might have headaches or vision
Yeah.
changes, which is definitely scary.
If anybody watched Downton Abbey, one of the daughters in Downton Abbey died from that after she gave birth.
Oh, I haven't seen that
Yeah.
movie or that show. I know
So
it's really, really well regarded. I think
yeah,
there's also a midwife show and that's
Call
coming
the
on.
Midwife. Yeah, I like
Yeah,
that show.
yeah,
Um,
yeah.
anyway, so this is just amazing, because for 5 days or however long they feel it's important, they're monitoring these women, they're monitoring the babies, the families are welcome to stay with them. And what a change that is going to make in that community.
So I have a question for you, just because, wow, it's a bit more litigious in the United States than
Mhm,
it is in Canada. Um, and OBGYNs in the US have super high malpractice insurance.
mhm.
Do you know how they work around that issue
That's a
at
good
all?
question. Somebody asked me that this morning, and I'm going to look into it because I imagine her
Yeah.
insurance rates are pretty high. The one thing that she made sure to mention is they only take low risk mothers.
Okay. Okay.
If there's
So
if there was a
obviously, if someone has longstanding high blood pressure during the course of
exactly.
their pregnancy, they're not going to be a candidate for this.
Yeah,
Okay.
but they
Okay.
would be a candidate for having a doula with them to help them advocate.
Oh, again, that is absolutely vital. Having a
Yeah,
doula, having a patient advocate whenever you encounter the healthcare system, I think is important.
yeah.
It's always nice to have someone else describe what's going on because as the patient, you're so distracted by your
Mhm.
pain, by your concern, that sometimes you can't voice your thoughts very well.
Yeah.
Yeah.
It was just an amazing visit, and I was so touched by her work that I'm actually following up and going to be doing something else for her. Um,
Now, you mentioned that this happened on the Thursday of the conference. How
yeah,
long is this conference typically?
it's a long conference. It runs from Thursday to Sunday.
Oh, okay.
Yeah,
So the field trip is on the first day
yeah.
to get you guys inspired, and then the following days you have the various topics. And what were some of the topics that you guys explored other than
Um,
this wonderful field trip?
there's some that pop up every year. There's always a panel at least on Alzheimer's and dementia.
Okay.
Of course, over the last couple of years has been COVID and long COVID. But then there's also there's usually something on gun violence, on domestic abuse. Actually, I have the pamphlet, the thing here. So this was this year's.
Oh, wow.
Yeah,
That looks solid too.
it's full. It's full. So there was something on refocusing on patient safety, changes in vaccine research, reporting on the misery of medical debt.
What is that last one? Reporting on the misery of.
Reporting on the misery of medical debt.
Oh, wow. Yeah. Did you know it's the number one cause of bankruptcy in the United States?
I've heard.
Oh my goodness. Even with the passage of what some people call Obamacare,
Mhm.
it still ends up causing so much financial strife for patients because they have so little understanding of their
Yeah.
health insurance benefits.
Well,
And
and
it's
that's
really
why
unfortunate.
when they plan these sessions, they try and figure out, what do we want the journalists to write about? What do we want people to mention to the public? And here's one about the biggest untold story in healthcare: 53 million family caregivers. I mean, that's huge. So I like to go to this conference, first of all, because I like to meet with other people who are writing about health topics and getting ideas. And I also like to go because I just get so much out of the vibe of people talking about
Sure.
stories that they've written. And we have the awards. We have the award banquet where people win awards for their reporting and stuff like that. And I think it's so important. Health journalism is maybe even more important now than it used to be, because there's so much health information online, and we've discussed it before. We don't know what's true and what's not, and how to validate what we're finding.
Yeah. Yeah.
So
Trust but verify, you know.
exactly,
Look for multiple knowledgeable sources,
exactly.
and definitely I agree with you, the importance of trying to tease out some of the challenging concepts of science and break it down into an understandable language.
Well, and that's why local journalism is so important, because I mean,
Yeah.
local papers are folding and local news stations are no longer local. They're part of these big conglomerates. But the thing is, when somebody wants to write about health and wellness, we do it because we want to educate. In my case, nursing is a very, I don't know if it's a word, educated profession. We're constantly teaching, we're constantly
Yeah.
explaining things. And so for me, writing about health is an extension of that.
It's funny. The term doctor comes from the Latin phrase docere, which means to teach.
Mm-hmm.
And, I think one of the extremely frustrating aspects of my job in the last decade or so was I saw that time that I normally had to teach the patient or their family about what was going on with their
Yeah.
illness just totally frizzled away by getting called out to the room for another issue, or having to sign an
Mm-hmm.
EKG, or having to fill out a note for work,
Yeah.
things that were not relevant to ensuring that the patient understood their illness,
Mm-hmm.
and that the family knew what the next steps were, so crazy. So I agree with you. I think that medical journalism really has an even more vital role to play now.
Mm-hmm. Yeah. And so I think what I'd like people to know is when they're reading these articles, obviously, like we keep saying, trust but verify, but also think about why we're writing this article.
Right.
Why
Right.
did that topic come up? Why did that writer decide that they wanted to write that article? Or why did the editor assign that article to this person? So, we're going to see lots of similar ones. So when Jimmy Carter started palliative care, okay, or
Hmm.
hospice care, what's the
Yeah.
difference between hospice care and palliative care? Lots of news organizations did that. But then there's the more local stuff. And and it's very eye-opening. I was just thinking, excuse me, I was thinking of a field trip I did in Phoenix. Um, Again, I'm a little bit embarrassed that I never thought of this. I'm a nurse and I never thought of this. When you have people who are experiencing homelessness, if they're sick and they need an IV antibiotics over a long course of time, if they've had surgery and they need to have their dressing changed, if they need chemotherapy, but they don't live anywhere, where do they go? Right? You're discharged from the hospital and you have a wound, you're going to go back to sleeping under the overpass. In Phoenix, there's a residence that takes in people who are experiencing homelessness to take care of their medical needs. And while they're staying there, they get the social work and everything, and they get all the intensive help. And so they go there, they get their chemotherapy, they get their IV antibiotics, they get their dressings changed. And then as a community, they get help to get off the street. I never thought of that.
During the pandemic, we had COVID hotels for the homeless where, they would be housed until they were feeling better.
Mhm.
And it was a method of trying to slow the spread
Yeah.
among some of these large homeless encampments, and also to give a roof over their head and a warm bed to try and
Mhm.
help them heal.
Yeah.
The vast majority of patients who are healthy, they just need time and
Mhm.
um, to heal. This was before we had medications available to us,
Right.
and then it would also allow for closer monitoring so we could
Mhm.
see if they were decompensating and requiring more medical attention. Yeah,
Mhm.
really important.
Yeah, it's a great when you're working in any kind of career, you need to constantly educate yourself to stay up to date.
Oh my
And
goodness, yes.
something like this just gives you a different angle, a
Yeah,
different way of looking at things.
yeah.
And I even discussed for a lot of people, I discussed Decipher Your Health. I talked to somebody from the NIH. I talked to lots of different people, and they all thought, what a great idea. We really need this. People need to be able to advocate for themselves. We really need something that will help people understand what's going on. And I had nothing but positive comments about our project.
I think one of the challenges that we will probably face is that patients want to trust people that they know from their
Yeah.
community.
Mhm.
Why on blue blazes should they trust you and me
Yeah.
when I live all the way in California and you're all the way up in Quebec?
Yeah.
And, it's really interesting when you talk to traveling nurses about where they've been previously, and you realize
Mhm.
how regional medicine is,
Yeah.
how the language used to describe hemorrhoids, for example, is
Mhm.
different. It's called piles in the South.
Mhm.
Or, my goodness, the different methods of treating constipation.
Mhm.
Molasses enemas versus soap suds enemas versus, what we call the bomb.
Yeah.
So there's loads of different regional methods of treating illness that oftentimes we're not aware of,
Mhm.
from what people will use in the community just based on what their grandmother told them, what they recommended,
Mhm.
versus what they're going to get when they go to their local hospital.
Yeah. Yeah. But one thing I
Definitely.
did want to point out, I got this when I was in St. Louis. I got sick. I got a cold. It wasn't COVID. It's a cold. I was very careful, even with my masks and everything. So be careful when you travel still, because
Yeah.
here I am more than 2 weeks out and my asthma still isn't happy.
I think the other challenge is, in the emergency department, wow, I was just exposed to so many viruses, with cute
Mhm.
little 2-year-old Timmy doing a nice direct shot right into my face when he's sneezing or whatever the case may be. And then during the pandemic, as we were wearing our face masks and our face shields and the whole 9 yards, sometimes we weren't getting exposed to all those viruses. And same goes for in the preschools and the elementary
Mhm.
schools. So I think that was part of the challenge with when we reached the next phase kind of in 2021, 2022, when all of a sudden we're seeing a huge uptick in RSV because
Right.
no kids were around one another to spread it.
Exactly.
So now that everybody's traveling again, oh, great. Let me give you not only a firm handshake, but my human metapneumovirus, which will
Yeah.
give you a great case of bronchitis later,
Yeah.
and just the fact that these little respiratory droplets can, you know, go right into the eyeball or up the nose or in your mouth or,
Mhm.
it makes it pretty hard to avoid these.
It does. It does. But hopefully it won't be too much longer.
Right, right. Hopefully you're resting enough. Now, were there any standout presentations that happened after your field trip that you want to share with us?
Excuse me.
And I'm glad you're not sharing the cough. Thank you. Appreciate that.
Well, I'm not contagious anymore. This is the after effects.
Right. And you bring up a really good point there. oftentimes with a viral infection, that cough can linger up to 5 to 6 weeks after,
Yeah.
and again, the importance of not starting antibiotics because antibiotics won't work when it's a viral infection. Antivirals may work, but unfortunately, we still do not have an antiviral for the common cold. We
That would
have
be so nice.
Paxlovid for COVID,
Hmm.
and we have antiviral agents for HIV, for example. And we have antiviral agents for hepatitis C.
Hmm.
But not every virus has an effective antiviral treatment.
Yeah, and that's frustrating.
Yes, yes, isn't it?
Okay, let's see. I'm trying to say what I went to.
I think one of the other awesome parts of actually having these conferences again is the exchange of information. Because oftentimes, if we get kind of in our tiny little worlds, in our little communities, all we're seeing is the actions of those around us. So it's a great way to exchange information, whether it be how to best explain to patients what their risk is of getting direly ill from,
Mhm.
the COVID virus versus how to best protect themselves versus explaining what absolute risk is,
Mhm.
relative risk, um, all those important things.
I'm trying to find the one that I went to that I really liked.
Did you guys go over the current? I have here Alzheimer's, dementia. You went over gun violence, domestic violence, refocusing on patient safety. Did you guys go over steps with the narcotic pandemic that's starting to percolate and
We
the
almost always do. I'm trying to see.
yeah.
Um, there's the caregivers, Alzheimer's.
Yeah, this past fall, it was really frustrating to see even patients who said that they didn't use heroin or any kind of narcotic, but did engage in illicit drug use, whether it be the use of cannabis or, well,
Hmm.
which is not considered a criminal offense in some states in the United States, or whether they were using methamphetamine. Now
Hmm.
we're seeing fentanyl laced
Yes.
in these other items. So I recall talking to a few of these folks, like
Hmm.
after they were given Narcan and started to breathe independently again, going over with them, the
Hmm.
importance of being careful what their sources are. And at least if they're going to engage in those activities, having some Narcan nearby.
Yeah, that was discussed. And what's interesting too is there's also exhibitors. And
Okay.
so I got to speak with a PR person from the Physician Association, um, physician physician assistants, and now they're called physician associates. I also spoke to somebody from the American Medical Association. So again, talking about Decipher Your Health, talking about how important it is that we work together, because I think one
Right.
of the primary important things that we really need to get across is we're really working hard to help patients and loved ones be advocates. But I think we have to work equally hard to make sure there doesn't become an adversarial approach.
I agree.
Doctors and nurses and other healthcare professionals, we learned in our little silos, and then we went out and started to practice. And this is new, having patients come to us more informed than they used to be. And we need to learn how to work with them. Our first initial reaction is, how did you learn that? How are you telling me my job? Why are you telling me how to do my job?
Some people do get quite defensive. Do you remember when they used to have those Dr. Google mugs?
Yeah,
Dr. Google does not replace my years in medical school or whatever the
exactly.
case may be. Yeah,
Exactly. And
yeah.
you know what? It's not entirely wrong to have a reaction, because a lot of, sometimes the information that they get isn't right, and we need to correct it. And that can take more time than actually educating them in the first place. Why is
I
this information wrong?
Yeah,
Mm.
I think the way to go about it is to get curious
Yeah.
rather than be defensive. I don't know if I told you about that uh, Uber driver who
Mm.
was telling me that he got medical advice on TikTok that recommended that he use marshmallows to calm his sore throat. You know, he didn't have great insurance. He couldn't get into his primary care doctor. So he
Mhm.
thought, what the hey? And it worked great. Like his sore throat felt so much better when he was eating the marshmallows. But it put him in DKA, diabetic
I
ketoacidosis,
was just
because he
thinking
was
that.
a non-insulin requiring diabetic and didn't understand how,
Okay.
eating that kind of raw sugar was going to tip him over the edge. He
Hmm.
already has an infectious disease that's putting him at higher risk of DKA anyway. And then he
Hmm.
just turbocharged it by living on a diet of sugar. So trying to explain that, you need to be careful where your sources are coming from. And, some buddy of yours who's recommending marshmallows on TikTok doesn't know your whole medical
Right.
information,
Right.
so trying to get a hold of your provider, seeing if your health insurance company has an advice line that you can call into to ask
Hmm.
for what would be ideal cures, or talk to your pharmacist. A lot of times the pharmacist can give you recommendations and
Yeah.
direct the diabetic to sugar-free options.
Yeah, exactly. And I think pharmacists are the least known first line healthcare professionals. I think
Mm-hmm.
people really don't understand their very important role. They do more than just count out pills and make sure you're getting the right thing.
Right.
If you should only be using one pharmacist to begin with. And
Yeah.
so if you have multiple doctors, or let's say you have you have specialists and that sort of thing, and you bring all your prescription to this one pharmacy, he or she can say, you shouldn't be taking that because this doctor said you have to take this, and they don't go well together. So either the pharmacist can contact the doctor, or depending on what the medication is, may be able to have a workaround.
Yeah, they can definitely do something called medication reconciliation, where they'll kind of clock in all your medications and make sure that there's no interactions going on between them.
Mm-hmm.
In the state of California, they're now allowed to give vaccines,
Here too, yeah.
and they can distribute some medications without a prescription from a doctor.
Mm-hmm.
Uh, I really feel like they're feeling a little bit overwhelmed because one of the unintended consequences of the electronic health record. Um, you know, I will admit I have horrible handwriting. So when I would write my prescriptions by hand,
Mm-hmm.
oftentimes the prescriptions can be misinterpreted by pharmacists. So
Oh
there
yeah.
was a real big push with the electronic health record to get everything online
Mm-hmm.
and to send the prescription to the pharmacy electronically. The challenge is a lot of times patients decide they don't want to fill the prescription. So the
Mm-hmm.
pharmacists are running around filling all these prescriptions for patients that are not going to arrive to pick it up. And you then have a supply of medications that are already put off to the side for prescriptions that will never be picked up.
Right.
So we're dealing with some supply and demand challenges as well with that.
Mm-hmm.
It's a little bit kookaburra. I'm not sure what the perfect solution is, whether we need to go back to printed prescriptions where the patient
Has to bring it.
takes a prescription to the pharmacy, or wouldn't it be great if they allowed hospitals to have pharmacies attached to them where you could hand the patient, or the clinic,
Yeah.
where they were used more frequently, but it seems like it's gotten more difficult to be sustainable. So a lot of these local pharmacies within primary clinic buildings or
Mhm.
hospitals have closed.
Yeah.
It's a challenge.
Yeah. I think it's challenging no matter what area of healthcare you're working in. And that's why it's so important for us to work together. And I don't want anybody to think that I'm trying to, you know, we're not trying to it's not a militia. We're not trying to push people into being militant. I have to have this care, I have to have that care, I need to do this, I
Right.
need to do that. We want them to be educated so that they ask the right questions. And if they don't understand the answers, to ask for clarity. Because even as a nurse, it's happened to me a few times with my kids being discharged from the hospital and that sort of thing. I'm not in nurse mode anymore. I'm mom mode then. And there have been mix-ups in medications or discharge orders because the nurse who gave me the discharge orders knew I was a nurse and didn't bother going over them. I was in a
So
rush to get home.
Yeah, I do agree with you. Like the whole clear is kind.
Hmm.
I think we do have to take a lesson from the when we look at pilots, how they do
Yes.
the well, we call it the teach back method in medicine,
Hmm.
but you have the person state back to you what they think they heard.
Yeah.
And I think that works well when I'm hearing a patient tell me their story. Or if you're even having an argument with your son over X, Y, or Z thing, what I think I'm hearing you say is this what's going on?
Right.
Because it shows that you're actively listening and not thinking about that episode of Breaking Bad from last night or whatever the case may be, you
Yeah.
know? Yeah.
Yeah. And the whole thing is that we have to work together.
Hmm.
It's not the doctor or the nurse or the other healthcare professional tells you something and you just blindly do it. It doesn't, it's your health. You have to be responsible for it.
Well, and I definitely feel like there's been a paradigm shift. It does depend typically upon the generation of the
Hmm.
patient. Some are very much defer to the physician or the nurse practitioner or the PA. Okay, doc, I'll do whatever you say.
Yeah.
And then there are much more actively engaged patients who they want to drive the bus. So
Hmm.
they don't have a primary care physician. They feel like they're healthy enough. They exercise on a regular basis. They eat well, and they come in with a particular problem that they want addressed, and they will
Right.
come with research galore, and being able to say, this is your body. It's obvious that this is important to you. You've done some research. Let's look at the research together.
Yeah.
Um, and making sure that the patient understands that visit may be only 15 minutes long, so they may not get all their answers right away.
Hmm.
The doctor may want, or the physician's assistant, physician's associate, or the nurse practitioner may want to take the time to do some more research for you.
Hmm.
you know?
Hmm. Yeah. And I've had that personally with a few issues. And it's like, I don't have any answers for you now, but hopefully I will the next time you come see me. It's like, okay, go for
Perfect.
it.
And if you do have a chronic illness, I do think having a primary care provider is important.
Hmm.
I think one of the concepts that sometimes patients have a difficult idea dealing with is that sometimes we'll go through a stepwise fashion when someone
Hmm.
comes in with a sore throat, for example. We'll check them for strep throat. We might not necessarily run any blood tests. Then, if the symptoms are continuing to last or additional symptoms are coming on when they come back in, then we may check for mononucleosis.
Hmm.
But it takes like 2 weeks for a mononucleosis test to come back positive from started symptoms. So it
Hmm.
doesn't make sense to do scans on everyone who comes to the emergency department because it's a limited good that we have there. So we can't MRI everybody from head to toe the
Right.
minute they come in feeling lousy.
Hmm.
So sometimes we'll do a stepwise fashion, or a care provider might try one agent and then wait to see if there's a change in your blood pressure with the first blood pressure medicine that they
Right.
do and have you come back a month later, you know. And I think sometimes it's frustrating for patients in our current society. They want a result yesterday. They want to
Yeah.
feel fantastic tomorrow. So sometimes I think it's a little tough for them.
I think also, why don't we talk about pain now? Because I'm going to think,
Sure,
okay.
sure.
Okay. I think we also, as patients, have to consider the language that we use. Like,
Yes,
we know that we've been feeling lousy for X amount of days or whatever. I mean, no, I'm not counting the emergencies that when I dislocated my shoulder, it was like, oh my God, that was agony until it was put
yes.
into place. But if it's a chronic thing, you've been feeling terrible and you need help. So, but when you go see that doctor for the first time, like I have something, they're calling it atypical burning mouth syndrome. And burning mouth syndrome is rare enough as it is. And then the way I have it, it's on my lips. My lips are burning like they're on fire all the time.
Wow.
So when I first go to a doctor, that's what I tell them. I say, it feels like I've splattered bacon grease on my lip, except it's all over, all the time, 24 hours a day. I can't get more descriptive than that.
That's pretty darn descriptive. Yeah, throw a little cayenne pepper on there and we've got a story. Youch. That sounds like
So,
absolute misery.
oh, it's awful. Drinking hurts, eating hurts, talking hurts, everything hurts. But it took me a long time to get that succinct. I would start with, well, my lips were tingling and then they started burning. And, the doctors didn't, but you could almost see their eyes roll. It's like, get to the point.
Yeah.
Why are you here?
It's really tough because we do have such a limited time. So I know there's plenty of doctors that probably have given eye rolls, in a situation like that, especially if it's a Friday afternoon at 3 o'clock and they're thinking
Mhm.
about the huge number of charts that they have. So how
Exactly.
did you figure out how to break down your story more effectively?
It just came, I've been living with this now for about 7 or 8 years. So it just came with, every time I told my story, I started to condense it a little bit more, a little bit more. And then one day, I think I was talking to a friend and she said, well, how would you, and she's a nurse too. She said, how would you describe it? And I had always been describing as burning. And I thought about, everybody's splashed something hot on their lip at some point.
Right, right.
And I thought, okay, that is exactly what it feels like.
So you're reminding me of this hilarious video. If you guys want a good laugh, by a comedian called Brian Regan,
Yeah.
and his visit to the emergency department, and he talks about describing when he has abdominal pain, and he's talking about it's like my organs are on the outside, and then he goes back to a TV show that was very
Pyramid.
common.
Yeah.
Yeah, the Pyramid Game, excruciating, so very, very
Yeah.
funny.
Yeah.
I know pain is not a laughing matter, but
No, it's
sometimes
not. But the
humor
thing
is
is,
a way
yeah.
to
And the thing
dissipate.
is, to be as succinct as possible. So if you have abdominal pain or, some other chronic pain, think about the best way to describe it in an elevator speech, as few words as possible. If you only had 5 seconds to tell somebody how much it hurts, how would
Yeah,
you?
I think one of the challenges too is, I've had patients who come in with back pain that they've had for 9 years.
Hmm.
And there's a part of me where I'm just like, 9 years and you're coming to the emergency department now,
Hmm.
5 minutes before my shift is over, you know,
Yeah.
and trying to figure out and having that pause and realizing this patient is reaching their wits' end,
Yeah.
you know, and oftentimes one of the frustrating aspects of my job is that I cannot tell them what is causing their pain. Sometimes I can tell
Mhm.
them what is not causing their pain. For example, they're coming in with chest pain or abdominal pain, where I can rule out the ugly causes, because in
Mhm.
the emergency department, it's all about emergencies, right?
Yeah.
Um, that sometimes, unfortunately, feels like it's not enough for that
Mhm.
patient, and I really think patients with chronic pain, that a wonderful resource for them is the use of cognitive behavioral therapy,
Mhm.
and trying to get curious, and also the art of distraction. I bet your pain is much better when you're quilting,
It's
because
better.
you're able to get your brain on a different track. I
Yeah.
mean, wow, the brain is so powerful. I have
Mhm.
seen women give birth to 10-pound babies without an epidural, and
Mm.
they're just doing the deep breathing exercises. And I've also seen people have such severe pain at the loss of a loved one that they've had horrible heart attack. It's called
Yeah.
Takotsubo syndrome or broken heart syndrome.
Mhm.
So the brain can do incredible things, both good and bad,
Mhm.
and trying to learn the art of um, distraction can be valuable.
Well,
What do
just
you
think of
think?
the gut and the brain connection. I
Oh
mean,
yeah,
people who get very stressed end up running to the bathroom,
right,
and
right,
how does that connect? Well, the gut is considered another brain, right?
yeah,
It's just
yeah. And you got over 20 feet of it, with plenty of serotonin reuptake inhibitor there. And that brings up the point of you are what you eat. We
Mhm.
do know that if you follow certain diets, it can affect your mental state. You
Yeah.
know, people who eat a whole lot of sugar, they'll feel fantastic for about 20 minutes and then they'll feel miserable, you
Yeah.
know?
And
And
that
it
all
can,
goes back to how you're talking to your doctor or your nurse practitioner or physician
sure,
associate. Not only, be succinct about the pain, be succinct about what you've tried.
right.
I have pages of treatments that I've tried over the last 7 years. And now, actually, when I go in, I tell them I'm not the most reliable historian anymore because I've tried so many things. But these are the things. Here's a list of what I have tried that I know for sure. There are some things on there that I've forgotten over the
You're
time.
bringing up a really important point, is we used to say good historian, for example, when we
Mhm.
were talking about the person who's providing the story. And I'm wondering if we need to change that term because sometimes we'll say unreliable historian, poor historian. And if you think about it, if you're coming in with a femur fracture,
Oh,
you're having a bit of a difficult time trying to convey maybe everything that happened, you know.
mhm,
Or if you've gotten a dose of pain medications in the ambulance on the way into the hospital, how
mhm,
good a historian can you be? Um,
mhm.
but rather than place the onus of the responsibility on the patient, maybe we should say challenging history
Okay.
or
Mm,
uh, difficult history
mhm,
because the person doesn't speak the same language as
mhm.
me, because the person is hard of hearing and forgot their hearing aids, because the patient is deaf and they can't read lips, because the patient, has pain medications on board. So rather than placing the onus of responsibility on one individual, we
Mhm.
can just say, this was a challenging history,
Yeah, I like
and
that.
I think now that patients are reading their health records, you
Mhm.
know, we have to walk that tightrope,
Yeah.
in the time of patient satisfaction scores, et cetera,
Mhm.
and not have them feel like we're being condescending, that we're,
Exactly. Yeah.
trying
Yeah.
to
I use
belittle
the
them in
term,
some way.
that's it. I use the term simply because I know that that's what they know, but you
Right.
make a really good point. And I started saying that probably about 6 or 7 months ago when I was repeating my story yet again. And I realized after that there was a lot of stuff that I'd forgotten to mention.
Do you have electronic health record to the extent that we do in the US?
Not for patient charts. You can
Okay.
go into, and depending on the province. So in Quebec, we can access our test results 30 days after they've been reported
Okay.
on the Quebec government site.
In the US as of October of 2022, patients have immediate access.
Mm-hmm.
So words that we commonly used in our notes, we've been
Mm-hmm.
instructed not to use just because we don't want to offend
Right.
patients or families in some way. Um, Gosh, and it's strange how words that we use so commonly for so
Mm-hmm.
many years, like demented,
Mm-hmm.
even, you
Mm-hmm.
know, is now memory loss, perhaps, or trying
Yeah.
to specify what activities of daily living the person can do at this point. And
Mm-hmm.
obese is definitely a third rail. You want
Mm-hmm.
to stay away from that term. So sometimes people might use the term elevated BMI.
Mm-hmm.
Because we do know that if you have an elevated BMI, you are at higher risk of having challenging surgical procedure, challenging general anesthesia. So it's not meant to be denigrating, or
No.
it's just to help
Yeah.
prepare the treatment team for
Mm-hmm.
challenges that may lay ahead.
Mm-hmm.
Um,
Yeah. It can be disconcerting reading your own chart, even if you know the reasoning behind the language, because there
right,
have been a few times where I've read reports and I thought, that's how they see me.
right. Oh my goodness.
And
Yeah.
but I knew the reasoning behind the words, but to see it actually written down it can be very disconcerting.
I think one of the challenges in general is making assumptions about people.
Mm-hmm.
On the one hand, we're given such a short timeline to see the patient, address the issue,
Mm-hmm.
figure out what the next steps are. So on the one hand, we're trying to improve our observational skills and try and come to a conclusion
Mm-hmm.
relatively quickly. The patient wants answers, so do I.
Hmm.
I love deciphering people's health. On the other hand, it can be challenging if you make assumptions. You see that a patient's been to multiple different doctors over the
Hmm.
course of 10 years and don't realize that maybe it's because they lost their job and had to get new insurance, or their insurance company changed at their regular job. And so rather than assume that they were doctor shopping, maybe you should be more curious.
There's the appearance too, because I started
Yeah.
going to a pain clinic here in Montreal associated with a major hospital. And when I went for the first appointment, it was like an orientation. There was a bunch of people who were going to be patients there. And you had to fill out your forms and you rate your pain 1 to 10, that whole bit. And, there were people there who could barely walk because they had such severe back pain. There were really people from all different walks of life there. And I filled out mine. And I usually, when I'm asked for a number, I'll say usually the pain is like a 7 or an 8 because it's really bad, but I don't look like I'm in pain. I'm walking around, I'm doing what I need to do, I'm working, I'm functioning, I'm doing things with my family. And so I was put at the bottom of the list. And I remember when I got that letter, I cried. I was so upset. But it was because I don't appear to be in pain. But I guarantee you, I am in agony, but I don't have a choice. I have to function.
Right, right. The pain scale, I think it originated after World War II in trying to figure out how severe pain was in soldiers who had been
Mhm.
injured in war. And then folks up in Canada at McGill University developed that whole 1 to 10 scale
Yeah.
to help with research projects in trying to
Mhm.
figure out, okay, is this agent helping with this
Right.
person? That kind of thing. And I think that some people definitely have taken advantage of the pain scale in a positive way or a negative
Mhm.
way. Um, and hearing how the pain affects your activities of daily living, is
Mhm.
definitely an important portion of, for me to understand, how
Mhm.
severe this pain is. Also, explaining the quality of it. When did it first start? Is
Mhm.
it burning, like you were talking about? Is it stabbing? Is it dull?
Mhm.
Because there are different pain receptors in the body. And for
Right.
example, early appendicitis, you can have a very vague abdominal pain that feels like you have bad, reflux.
Mhm.
You had too much spicy food last night. And then as the appendicitis evolves, it'll
Mhm.
localize more to that right side and become more sharp. Um, uh, I think that in the next decade, we are going to discover so much more about pain. I think that it's interesting to see how
Mhm.
some pain levels can be so different in some families, and finding genetic links.
Well,
That family in Italy that has no
right.
ability to feel pain, they walk around with broken limbs and not realizing it.
When my daughter was in kindergarten, she broke her wrist and she fell at the park. She was on the monkey bars. And when I brought her to the hospital, and Montreal Children's Hospital is a great hospital, they looked at her, they said, it's not broken. She's not acting like it's broken. I said, okay, then Mama Bear came out, right? Said, you don't know my daughter. It's broken. No, no, she needs an x-ray. It was a clean break right across.
Wow. You're bringing up a really good point. I have had to eat humble pie on plenty of occasions,
Mhm.
where patients have come in and, kid fell off the monkey bars or whatever the case may be, and would have just a tiny little bit of swelling, but that was because someone there was smart enough to get ice on it right away, was able to
Mhm.
get it elevated. And, I listened to the mom and I said, well, it doesn't really have that much swelling and he's moving it around pretty well. But you know your son much better than I do.
Mhm.
This is just a brief moment in time. And if it will help you sleep better tonight, because you know him so well, let's go ahead and get the x-ray.
Mhm.
And don't you know, it came back with what we call a buccal fracture, you
Yeah.
know. But trying to explain to the parents sometimes that not every um, fracture requires a specialist, that some
Right.
will heal okay, you
Mhm.
know.
I
Yeah.
just remember that feeling of helplessness
Oh
because
yeah.
she doesn't act like I'm right now, not acting like I'm in a lot of pain. She wasn't quite herself, but she wasn't acting like she was in a lot of pain. But I know her.
Well, it's funny, when my kid broke his arm pretty badly,
Mhm.
he refused all pain medicines when the television was on because, at the time we did not have a TV. He's in the emergency department. He had a pretty obvious deformity. And he just was so excited to be able to watch Finding Nemo that he was like, just don't touch me and I'm fine.
Mhm.
But distraction definitely works. We found that most definitely with pediatric population. So
Mhm.
when kids come in and they might have a cut that requires stitches, or they've got a broken bone that we might need to put back in place, I oftentimes will ask the parents, please, if you have your phone or your iPad there and there's a favorite TV show, save it. Don't
Mhm.
let them watch it right away. You distract them with coloring book, distract them with other books. But when we go
Mhm.
to do the procedure,
Right.
another way that we can calm the child is to allow them to see their favorite TV show, you
Right.
know. And I do like to try and keep mom and dad or a family member there that can remain
Mhm.
calm during the event. Kids can sense when parents are stressed. So
Mhm.
if you are freaking out, screaming, all that stuff, your kid will
Yeah.
mimic your behavior, and that does not do your child well.
No,
Okay?
it doesn't.
So
No.
having a calm parent who can be loving and kind and maybe tell a good bad dad joke or two, it does wonders to help distract
Yeah,
a child. Oh, and
absolutely.
as long as I'm on my soapbox, Marijke, please forgive me, but please, parents, do not tell your child that if they do not behave, they're going to get a shot from the doctor.
Oh, oh,
Please do not do
oh,
that. That is
oh.
the worst thing to do.
Yeah.
Because sometimes shots are necessary. We do know that vaccines have helped eradicate
Mhm.
smallpox, for
Yeah.
example, from this world. They've made polio almost non-existent in the US, although we now have an outbreak in a
Mhm.
portion of Brooklyn where they don't vaccinate on a regular basis. And, I think the important thing to realize is that shots can definitely help protect your child.
Mhm.
So don't use it as a threat, okay?
Mhm.
That's never an appropriate punishment, you
I
know.
have to laugh because when my daughter-in-law brought my granddaughter for her first shots, I think it was 3 months. I can't remember now. She was all excited. She's like, "Yes, she's going to get her first shot."
Oh, it's all about perspective, right? And then you just give that child a whole bunch of doting lots of love.
Yeah.
Um,
No, she was thrilled.
it's just unfortunate what's happened with, certain members of the medical community trying
Mhm.
to create a link between vaccines and autism. It's really doing a disservice to all these
Yeah.
children,
Mhm.
because, measles, although it can cause a mild rash, cough, runny nose in some, it can cause life-threatening inflammation of the lining of the brain in others,
Yeah.
what we call encephalitis. It
Yeah.
is not a benign disease. There's a reason that we developed a vaccine to help prevent it.
It's really scary. There are a lot of things out there that we could prevent that unfortunately aren't always prevented.
Yeah. Well, I'm sorry. Boy, I just made us do a major digression and wanted to see, are there any other highlights of this conference that you want to mention?
Um, Not off the top of my head. I can't think of anything else right now.
Now, with your atypical burning mouth syndrome,
Mhm.
does it affect your throat at all, or so just the lips?
Just the lips.
And so 8 to 9 years ago,
Mhm.
did you suffer from a bad sunburn or anything that
Not,
could have triggered the event that you think of, or?
not that I can think of. I had very tingly lips for a long time. I
Okay.
remember when my
Uh-huh.
daughter was Irish dancing, I used to drive her to Syracuse and all these places, and I always had chapstick in the car.
Uh-huh.
And then the tingling started to get worse and worse. And I thought, well, maybe I'm addicted to chapstick because I know that can happen. And
Yeah,
so,
Carmex, I think, had a problem with that. That
so I
was one of the
forced
brands.
myself to stop using it. It just got worse and worse. And then the tingling started to become a little bit painful. Then it started to get a little bit more painful. I didn't tell anybody, not even my husband, told nobody. How stupid does that sound? My lips hurt. So I probably lived with it for about 3 or 4 years before it got so bad that I finally told people because they were noticing I love wine. I'm a huge wine drinker. I wasn't drinking wine. I wasn't eating the food I like to eat. I can't eat anything spicy. I can't eat anything hot. I can't eat anything cold.
That could really cause a challenge at any kind of family gathering or trip to a restaurant. You're sitting there with a lovely meal in front of you and you can't take a
Yeah.
bite. Yeah.
Yeah. And it was only then that I started admitting it. And I finally told my husband, and I finally told my GP. And then we started, and it's just, I've seen specialists, I've had treatments that would make you shudder. I've tried alternative, I've tried complementary, I've tried, you name it. I don't think there's anything we haven't tried.
Okay.
And
Even acupuncture? I mean, because if
the,
you think about it, allopathic medicine has been around just a
yeah,
short blip on the radar compared with Ayurvedic medicine
yeah,
or
that
um,
was one of the first things
acupuncture.
I tried, and I've tried it a few times with different
Okay.
practitioners.
Wow.
Yeah,
Oh, that
yeah.
is incredible. I am so sorry that you're having to go through all that. Do you
Mhm.
find that quilting helps?
It depends. When it's really bad, no, nothing will help.
Oh, yeah,
Um,
makes sense.
but when it's like what it is today, then I'll go into my sewing room and I'll quilt and I'll keep myself busy that way.
Yeah, yeah,
Mhm.
yeah. I am so sorry that you're going through all that. Now,
One day we'll figure it out.
um, so Marijke, you've been talking about your atypical burning mouth syndrome. Was this a diagnosis that you got from the first doctor you went to, the second provider you went to, the nurse practitioner, the physician
Um,
associate? How did it come about?
the first, my GP just kind of went, don't know what that is.
GP
Um,
meaning general practitioner.
yeah,
So
yeah,
that's typically an internal medicine or family medicine.
yeah,
Is physician in Quebec, or can it
yeah.
be a nurse practitioner or a
We have
physician
very,
associate?
we are only starting with nurse practitioners now, and they're working in like urgent care clinics, and
Okay,
they don't have, and we don't have physician associates. So
okay,
it's almost always a medical doctor. We do have some DOs, but they came up from the States. We don't have a DO college, I think, in Canada. We might. I don't
okay.
think so,
And
though.
DO again is Doctor of Osteopathy
Right.
for you folks out there. Okay.
Yeah.
They also go to a 4-year medical school, just like
Yeah.
MD or medical doctor. They
Hmm.
also do a residency. They also have to take qualifying exams all the way through.
Yeah.
Yeah.
Yeah. So,
So
yeah. So this particular physician is a family medicine physician, and I've known him for a long time. So, he offered a few suggestions, but at that point it wasn't terrible yet. It was annoying, but it wasn't unbearable. So I let it go. And then I went to a rheumatologist because I also have fibromyalgia, and I mentioned it to him. And he's like, "Oh, I don't really know what that is." So we tried some fibromyalgia medications, thinking maybe that might be part of it. Um, didn't do anything. He was the first one who said something that it could be burning mouth syndrome. But then when I
So would
researched
he
it,
be the equivalent of a second opinion in your mind? Or
um, I'd say he was a second opinion because my family doctor had sent me to him for the fibromyalgia pain. And then while I was there, I brought up the burning sensation.
did the general practitioner feel threatened by you getting a second opinion?
Not at
Good,
all. Not at
good.
all. In fact, he's often the first person who will say something. Um, I'll go in, or my husband will go in with something and go, okay, I want you to go see this person. Okay, I think it's this, but I want you to see that person. So he's almost expecting you to go get a second opinion.
Okay, okay.
So, and that's been my experience with most physicians I've worked with clinically. I've come across the odd doctor now and then who's like, oh, doesn't believe me, but most of them are like, yeah, go ahead, make sure I might be wrong,
Okay.
you know.
And I think that brings up a point, when you have a rare illness or a complicated surgery that you need to undergo,
Mhm.
you know, you're gonna want to get a second opinion. And
Oh, absolutely.
hopefully the physician that you've gone to won't take offense at that, and who cares if they do? This is your life, your health, your happiness.
Mm.
You have every right to try and make sure that you find the ideal situation for you.
Well, there's
So
that
I
TikToker. Remember that TikToker? She had to have hip
yes,
replacement,
yes.
and she went above and beyond getting second and third opinions.
Can you explain a little bit more about that story for those of us, or do
Um,
you remember which TikToker it
she
was?
I don't remember her name offhand, but she's a fairly young person. I'd say probably early 30s, maybe. And she had to have a hip replacement, but she also has allergies to certain metals that are used in a lot of these replacements.
Oh, I think you're talking about, was her name Lillian? And it was actually her job.
Oh, her jaw. That's right. Yes,
Yeah,
yes.
so she had really severe TMJ on both
Right,
sides, and
right.
shared photos of her in her braces and
Mm,
pre-surgery, and you could see her jaw was quite crooked.
yeah,
And she lived in a rural community, so she didn't even have an expert who could do the whole procedure. She had to rely on
right.
two different clinicians. And oh, wow, she was so detailed and so
Yeah.
smart in how she went about things. I agree with you entirely.
Oh,
Yeah.
she was amazing. And if she hadn't have done that, she would have ended up with an implant with a metal in there that she was allergic to, which would have
Yeah.
caused a whole bunch of other problems,
Yeah.
you
Yeah.
know? So,
She had a nickel allergy, and
right.
when she was returning to these clinicians, she wore a nickel necklace to show that it
Mhm.
caused hives when
Yeah.
she was wearing it, and trying to state why she thought she needed to have another implant used to recreate
Yeah.
her joints here. And probably one of the best things was how methodical she was about going through each of her concerns and documenting everything. And
Yeah.
the physician was, it was probably a blessing in disguise that the local physician fired her,
Yeah.
um, because that allowed her to go to a specialist in a different area because she no longer had someone in that area. Now,
Yeah.
that doesn't mean you should go around being extremely mean to your local physician to try and get fired. Like,
No,
let's be
no, her
kind,
case
people.
was extreme.
But her case was unusual. Yeah.
It was unusual, but I mean, she did everything right.
Yeah. Yeah.
And she ended up paying for her own allergy tests to prove that she was allergic. So, and it's the same thing, like for in my case, or anybody that has a situation that has people puzzled, is not everybody knows everything, even if it's your specialty. There are
Right.
things that happen. So you
Um,
need
mm,
to ask, and you've used this example before. I had my kitchen renovated several years ago. I didn't just call one contractor to come and give me a quote. I called a few. I wanted to know what they were going to do, what materials they were going to use, how much it was going to cost me, and how long it was going to take. I wasn't going to take the first person who came in. That
you
doesn't make
know,
sense.
even when we're making a recipe, do we do the first one? Typically,
Mhm.
people look at more than one option before they jump on it. Um,
Yeah,
and this is having to do with your health,
yeah.
so of all things, let's be careful, and then the other important thing to do before you go into that second opinion is to check your health insurance, um,
Hmm.
uh, and see if that person is quote unquote within network, or whether you're willing to pay out of pocket.
Hmm.
But we do know that health expenses are the number one cause of bankruptcy in the US. So I would recommend trying to stay within your
Hmm.
means, you know.
Yeah,
Oh,
it's frustrating. And you know what though, and I can't blame people either for being reluctant, because it's exhausting. It's exhausting to tell your story over and over again. It's exhausting to answer the same questions again and again. And mentally, it's also discouraging because you're reliving it again and again and again. So it is very exhausting to get the second, third, and fourth opinions, but sometimes you don't have a choice.
And you bring up a really important point, at least in the emergency department, is sometimes patients will be so exhausted by the time I'm coming in to evaluate them. They may have been seen by the triage nurse, by the physician in triage, by the nurse for their room where they're staying, by the radiology tech, by the laboratory tech, whatever. And I come in the room and they're like, what? I don't want to tell my story again. I've already told my story 5 times.
Yeah.
And one of the challenges is that I'm the one who needs to document the story. The first 7 people don't need to document that much. So it's
Yeah.
really important. You may be asked to tell your story multiple times. So you might want to start with, do you want short version or long version? I do that even when I'm calling my consultants. Do you want the short version or the long version of the patient story?
Mm-hmm. Yeah. Well, the whole thing first of all, when you're seeking medical care, you're very vulnerable. Okay. No matter how important you are in your life, no matter how accomplished you are, no matter what you've done, you are in a very vulnerable place. Okay. You need somebody to help you with the most personal thing in the world, your health.
And
So
keep on mind, you're wearing a hospital gown that's paper
that too.
thin with your booty sticking out the back. So talk about vulnerable, both.
Exactly.
Yeah.
And so if you're like me, you're also fragile at that point. You're exhausted, you're vulnerable, you're sick, you're in pain, you're whatever. And you might not react to a healthcare professional asking you a question. You might not react in the way that you would normally react. Okay. You might be snappish. You might burst into tears. I've done that more than once. Um, it's important to realize that all these feelings are very, what's the word I'm looking for? Legitimate, right? And you have to accept that. So what I usually do is when I can feel the tears start, I'll say, I'm going to start to cry just to warn them. And then I'll burst into tears and then I'll get my story out. But the thing is, we're so vulnerable at that point that that's where the patient advocate, having somebody with you, is so important. I usually go to all my appointments alone because I'm independent. I can do things myself. But if you have somebody with you who can tell the doctor, no, she's not normally like that, or this is what she usually does, or, to give you that squeeze on the shoulder and to say it's okay, because it is so personal. You're so vulnerable. You're so fragile. And in many cases, you feel like you're not being listened to. I mean, you probably are, but you feel like you're not being listened to.
Oh my gosh. My mom had horrible congestive heart failure, and oftentimes, would have episodes where she would get flash pulmonary edema, where all of a sudden it feels like you're breathing underwater in a swimming pool, and so she would be huffing and puffing, and an ambulance would be called and they would ask her how she was doing. She'd be like, I'm okay. And I'm sitting there in a panic because I'm a little girl trying to say, she just can't breathe. She's only breathing, or she's breathing fast or whatever the case may be. Yeah, it was terrifying. Having someone there at the bedside who can explain how you normally are, especially, for example, with a demented patient. There's plenty of people who have mild cognitive decline or mild memory loss who are still relatively highly functioning, but they can't remember the way to drive to the grocery store.
Right.
They can't be trusted to light a fire, but they can still do a great job gardening in the backyard or, engage in witty banter with the grandkids. So trying to explain what the person's normal is and how this has changed, is a really important thing. Yeah.
Yeah. There's just so many pieces to the puzzle.
Yeah.
That, and they don't always interlock and you can't force it to fit. You've got to try and find a way around it.
I think the other interesting thing that's happening now that the healthcare records are becoming immediately available to patients is they're learning a lot more medical jargon, or maybe mislearning it or not appropriately learning it, or I guess one of my hopes with our Decipher Our Health is we can help patients to speak the way physicians think, so
Right.
that maybe we can help them move that time, that limited time that they have with their primary care provider, along a little bit more rapidly. You
Hmm.
know, I think definitely trying to understand the language of medicine is an important skill. So
Yeah.
hopefully we can help them with that as well.